Hello everyone, welcome back to a new session on dentistry and more. So today's topic is diet, nutrition and its association with oral health. So oral health, general health and diet is always interconnected. So let's see how the diet influences oral health and dental caries and diet. In etymology of dental caries, we have seen the connection between diet and dental caries. This chapter highlights the diet, nutrition, and its effect on the nutritional deficiency on the oral health and other factors. So the basic difference between diet and nutrition is diet is what you eat and drink, but nutrition is internal processing. From that foodstuffs, how much your body consumes. That is nutrition. It is the internal processing of foods and beverages such as ingestion, digestion, absorption and assimilation, distribution and elimination. So the whole process is nutrition. And diet is nothing but the foodstuffs you eat or drink. So this is a very basic chapter. This we have seen in our early years, like maybe first years, and even our early school life also we have seen this. The major nutrients, micronutrients and trace elements, carbohydrate, proteins, fats, vitamins, minerals and trace elements. So proteins, we know it is very important. So I'm not going very detail about proteins because it is very simple topic. There is not much explanation required. So it is required for body tissue, skin, tendons, cartilages, and it also forms hormones, enzymes. So we need to stress on the deficiency, protein energy deficiency, that is PEM, kwashiorkor marasmus. So kwashiorkor is nothing but word taken from the Greek language, and which means red boy due to the characteristic pigmentary changes. Later on the term was interpreted as Repo's child. So it was first recognized by Prof. Cecily Williams in 1933. So it was disease of first child when the second was on the way, displacing the first child from breastfeeding. So marasmus is known as wasting. It is a Greek word, marasmos, and it affects children exhibiting extreme wasting and old man appearance to jaws and skin and bones. So these type of appearance will be seen in children. So this is oral manifestation of protein deficiency. There will be bright reddening of tongue, loss of papillae and edema of tongue, bilateral chelosis, fissuring of lip, loss of oral pigmentation and dry mouth. So the basic thing is most of the oral manifestations are same for most of the vitamin deficiency, and there is slight variations in color appearance, but 60 to 70% is the same. So delayed eruption, deciduous teeth measure, linear dysplasia. So lipids, we know it is fats, basically saturated and unsaturated fats, and fat soluble vitamins A, D, E, K, which carries these lipids. So nutritional factors affecting the oral cavity. There should be optimal nutrition, period for hard and soft tissue development. So malnutrition, overnutrition will create problems such as the tetracycline staining of teeth, dental fluorosis, enamel defects in premature born children, and fever-induced enamel hypoplasia. So nutrients deficiencies or excess have been directly associated with conditions like protein, calcium, phosphorus, vitamin C, A, D, iodine and fluorine. So let's see the classification of vitamins: fat soluble A, D, E, K, and water soluble B complex and C. So B, there are various category: B1, B2, B3, B6, B7, pantothenic acid, B9, B12, which is cyanocobalamin. So vitamin A, its sources we know egg, meat and dairy products. Beta carotene also is a precursor of vitamin A. So these are the deficiencies: night blindness, conjunctival cirrhosis, Biddle spots, corneal cirrhosis and keratomalacia. So oral health, this is what we are emphasizing upon. Vitamin A helps in synthesis of proteoglycans, fibronectin, and type 1 procollagen. It is also helps in epithelial tissue differentiation, acts on cells with high turnover rate, and helps in formation of aminoblasts and orendoblasts. So what happens if there is a deficiency? It affects salivary gland, there will be decreased salivary flow, it causes increased caries, oral mucous membrane, there will be hyperkeratosis and gingival hypoplasia. In teeth, during pre-eruptive stage, deficiency causes enamel hypoplasia and defective dentine formation. So normal teeth spacing and osteoblast function of alveolar bone also will be impaired in case of vitamin A deficiency. And in periodontium, there is tendency to periodontal pocket formation. So as a result of this pocket formation, proliferation of basal cells of gingival epithelium and a decreased cellular infiltrate on the lamina propria. And there will be cleft lip and palate chances during early development of both deficiency and high doses reported to induce cleft lip and palate. Vitamin D, we know it is known as sunshine vitamin. There are D1 to D5 category. D2, D3 are nutritional importance. So these are the required daily allowance upper level. So only the fat soluble vitamins have upper level because it is getting stored, not like B and C, which is water soluble. So vitamin D deficiency causes enamel hypoplasia. There will be uncalcified dentine matrix. Physical roughness of enamel surfaces causes adherence of plaque and caries. So vitamin E, it increases resistance to inflammatory mediated tissue destruction and which improves gingival health. So in case of deficiency, there will be decreased inflammatory response and gingival health also will be impaired. So vitamin K, which is helping for the coagulation. If deficiency is there, there will be hemorrhage. Secondary deficiency also causes with antibiotics. Newborn infants receives a single dose of vitamin K at birth because of the sterile intestinal tract. So gingival bleeding and post-extraction hemorrhages are the problems associated with the vitamin K, and which is also known as anti-caries agent because it has an inactivity of enzyme inhibiting in the carbohydrate degradation cycle. Vitamin A and vitamin E have no known effect on anti-caries activity. So let's move on to vitamin B, that is a water soluble vitamin. B1, we know thiamine. So it is all these structures. Deficiency causes beriberi, wet beriberi, dry beriberi, and infantile beriberi. Wet means it has cardiac manifestations. This is a CNS manifestation, and infantile beriberi because it is seen in infants born to mothers suffering from thiamine deficiency. So what are the dental considerations? There will be tongue changes in form of enlarged flabby red and edematous appearance with engorgement of punctiform papillae. Gingiva becomes inflamed and present with an old rose color. So these type of features we need to keep in mind because always study link thiamine old rose color because most of the manifestations are same like I told. So the old rose seen in thiamine deficiency. Hepatic-like vesicles, palate, buccal mucosa, and tongue. So vitamin B2, riboflavin, it is the first B complex component to be isolated. And in deficiency, angular cheilitis, pallor of lips and angle of mouth, glossitis, magenta colored tongue causes. So this magenta colored tongue, keep in mind, caused due to atrophy of papilla and increased vascularization, seborrheic dermatitis, and proliferation of bulboconjunctival capillaries. Tongue changes, there will be the tongue changes, initial stages, reddish appearance of tip and lateral margins of tongue with coarsely granular due to atrophy of filiform papillae and engorgement of fungiform papillae will happen. So in severe cases which leads to atrophy of all papillae causing tongue to appear very smooth and glazed. So also deficiency leads to increased vascularization which causes tongue to appear magenta in color. So always remember riboflavin deficiency, seborrheic dermatitis, and magenta color tongue. So vitamin B3, niacin. So we know basic functions of nerve impulses and recirculatory free fatty acids. So let's see what are the dental consideration. It causes stomatitis, angular cheilitis, atrophic glossitis, severe gingival inflammation with necrosis. So tongue changes are epithelium of tongue appears desquamated, filiform papilla disappears first, and engorgement of fungiform papillae. So early stages, same as other deficiency, tip and lateral borders are involved. It becomes swollen, and advanced cases there will be severe reddening and becomes all the papilla losing. Pantothenic acid derived from Greek word pantos means everywhere. So formerly known as anti-dermatitis factor, which is a coenzyme A, metabolic role as coenzyme A. So dental consideration, ulceration and hyperkeratosis, gingival necrosis and resorption of alveolar crest. Biotin is anti-egg white injury factor. So it's high consumption of raw egg which contains avidin which tightly binds to biotin and reduces intestinal absorption. So there will be destruction of intestinal flora due to prolonged administration. So vitamin B6, which is also known as pyridoxine, it's dental deficiency. There will be lip changes. The most common thing is angular cheilitis, which initially presents as a pallor of the lip and the angle of the mouth. Then it is followed by reddening of lips due to disformation of epithelium at the angles. These visuals develop a yellow crest which can be removed without bleeding. So tongue changes are glossitis with pain, edema and papillary changes. Tongue has scaled sensation followed by reddening and hypertrophy of the filiform papillae at the tip margins and dorsum. Folic acid, which means leaf of vegetable. What happens is deficiency causes a folate deficiency. There will be defective absorption, hemolytic anemia, dietary deficiency. So folate deficiency causes these problems, that is macrocytic anemia. There will be increased risk of atherosclerosis, hyperchromocystinuria. So vitamin B12, cyanocobalamin, which is nutritional vitamin B12 deficiency, it's seen in elderly people and people with gastrectomy, fish tapeworm infection people. So dental consideration, B9 and B12 causes pernicious anemia. In dental consideration, initial oral symptoms is presented with glossopyria and followed by swelling and pallor with disappearance of filiform and fungiform papillae. Then bright red, diffuse, excruciating, painful ulcers will be seen. So vitamin C, we know that James Lind experiment, I have mentioned it in the epidemiology side RCT section. James Lind was one of the pioneers in epidemiology or randomized control trial. So he used his lime water for treating the scurvy. So what happens if we stop taking vitamin C? There will be hemorrhagic signs, defective synthesis of osteoid, impaired wound healing, and perifollicular hemorrhages. So vitamin C is a very important role in our periodontium because low levels of vitamin C influences metabolism of collagen within the periodontium. It interferes with bone formation leading to alveolar bone loss, which increases levels of ascorbic acid, enhances chemotactic and migratory action of leukocytes. These are the roles of vitamin C, and depletion causes which interferes with ecological equilibrium of bacteria in plaque, and it's increases its pathogenicity. An optimal level of vitamin C is required to maintain the integrity of periodontal microvasculature and wound healing. So vitamin C has a very crucial role in maintaining a proper periodontal health. So let's see what are the basic dental consideration as we discussed. Earliest manifestation of scurvy in gingivitis, which leads to periodontitis and tooth mobility and loss of teeth. So deficiency aggravate in gingival response to plague and worsen the edema, enlargement and bleeding. Vitamin C influences, we have seen in the previous slide, collagen metabolism of periodontium and affecting the ability of tissues to regenerate and repair itself. So scurvy is a very severe disease causing the gums, which leads to changes in the teeth in form of hypoplastic, leads to atrophy of amyloblast and odontoblast, and dentine formed, which lacks parallel arrangement of dentine tubules. So this is affecting both soft tissues and hard tissues. So let's see what are the minerals affected: calcium, vitamin D, and phosphorus, which are essential for proper development and maintenance of mineralized tissues, especially teeth and alveoli. So deficiency of these nutrients is a critical phase of tooth development, causing hypomineralization of teeth, and it might lead to delayed eruption. Iron deficiency anemia, which manifests in the oral cavity as pallor oral tissues, which we have seen with pernicious anemia. Tongue will be shiny and blunted filiform papillae. So mineralized tissues are less clear, the iron deficiency associated effect, and serves basically as a cofactor with ascorbic acid. So it has a role in vitamin C and its synthesis. So zinc regulates the function of inflammation by inhibiting release of lysosomal enzymes. Zinc deficiency can inhibit collagen formation and reduce cell-mediated immunity. This is important because sometimes question might come as trace elements and oral health. So zinc deficiency can also result in delayed wound healing, defective keratinization, and epithelial thickening and atrophy of oral mucosa. Also essential for taste and odor sensitivity. So diet and enamel mineralization. So dental demineralization can result from excessive toothbrushing, regurgitation of stomach acid, as in eating disorders like bulimia nervosa, or excessive consumption of acid containing foods or beverages. And also the effect of acid from diet is magnified in presence of xerostomia, because saliva helps to neutralize the acid. So dietary sources of acids are citrus fruits, uses acidogenic sports drink, snacks with citrus acid, the carbonated beverages, vitamin C chewable tablets, and the gastric regurgitation products. So role of carbohydrate, we know we have discussed in detail in epidemiology of dental caries. You know, streptococcus is a bacteria which needs a susceptible tooth, bacteria, and fermentable carbohydrate at appropriate time, which becomes epidemiology tetrad. So other dietary factors counteract the damaging effect of carbohydrates. So there will be always a balance between protective and destructive factors. So protective factors are fluoride, calcium, phosphorus in plaque and saliva, which promotes remineralization of early lesions. So that's all about diet and or oral health, or dental caries and oral health. So this is a very common question. It's been repeatedly asked. The diet and oral health, or diet and nutrition and its effect on oral health, diet and dental caries, trace elements and dental caries. So all these are very simple to study. Only thing, the same thing which we studied in first year or early school life, the same thing which little bit of oral manifestation make a good essay. So I'll come up with a new session on dentistry and more.